Vehicle collision. 33-year-old female was ejected from a vehicle that rolled multiple times, not wearing a seatbelt, and landed on the side of the road. She is alert but in severe pain with multiple abrasions and possible fractures.
Alright, let's take a look. BSI PPE. Nice. Is our scene safe? What do you think?
Scene is safe.
Scene's looking pretty safe. Alright, cool. The mechanism of injury, ejected from car. Number of patients looks to be about 1. Additional resources, definitely going to call it. Can you call additional EMS support, please?
Definitely calling for additional resources.
Spinal precautions, I'm definitely going to have you hold T-spine as soon as we roll up. Oh man. What's my general impression?
You have a 33-year-old female. She's laying supine on gravel. She has obvious deformities to her left arm and her right ankle. Large abrasions on arms, legs, and torso.
Okay, cool. I'm gonna have fire, hold C-spine. She's tracking me, so she's alert. Hi ma'am, can you hear me?
Yeah.
Can you tell me your name?
Alexa.
Do you know where you are?
I think on the side of the road.
Okay, do you know what happened?
I think I crashed my car.
I think you crashed your car. Okay, and do you know what month it is?
March?
Yeah, okay. And can you tell me what is hurting you right now?
My ankle, my right ankle, I found really hurt.
Okay, awesome, cool. Alright, I'm gonna assess her CABs. Can I see your wrist, please? Thank you. Her pulses equal and bilateral?
Her pulses are equal and bilateral.
Cool. Is there any major bleeding?
No major bleeding.
And what are her skin signs?
She is pale, cool, and diaphoretic.
Okay, so I'm gonna treat her for shock. I'm gonna have my secondary get a shock blanket, keep her warm, and proceed to administer oxygen via NRB at 15 liters per minute. Her airway, she's talking to me, so I'm assuming her airway is patent. Breathing, I'm gonna put SPF 2 on there real quick.
This will be on your face.
Alright, you gotta take a deep breath for me. 4. 10. Alright, what did her lungs sound like?
Normal and shallow breathing.
Alright, shallow breathing, so we're definitely gonna get oxygen on there. And then what was her pulse ox reading?
93% on room air.
Okay. I have my secondary take vitals.
Can I see your hand, man?
Doing a head to toe assessment, assessing for decap BTLS through the entire thing. So we'll start with her head, see if there's any bleeding. Is there any blood?
No blood.
Okay, I'm gonna check her facial bones, her cheekbones, her eyes. I'm gonna look behind her ears for any battle signs. Under her eyes, raccoon eyes. Checking in the ears and the nose for blood or CSF. Can you open your mouth for me? I'm checking her teeth, checking her tongue. It's all good. Okay. I'm gonna go down to her neck, checking for step-offs, and checking her throat for JVD and tracheal. Deviation. Right. Okay. I'm gonna go to her shoulders. Just down, down. Okay. Fire. I'm gonna have you slide your left hand out. Hold the collar. I measured beforehand. It was a no neck.
It's because I think they get really hot.
Yeah.
Because they leave them out and they get really hot. It's like every time I got them.
Down. Check your chest. Your hands. Are you feeling any pain in your abdomen?
Everything hurts.
Okay, sorry, this might be cerebral.
Ow.
Check your legs. Can you take a deep breath in for me? One more time. Cool. I'm gonna check her hips for pelvic flouring. Good. I'll do armpit sweep as well, check for any blood. Now I'll go down to extremities.
Ouch.
Check your kneecaps. down. Check CSM. Her posterior tibial pulse is equal and bilateral.
Pulses are equal and bilateral.
Okay. Can you wiggle your toes for me, ma'am? What side of the foot am I touching?
Outside.
And what side of your foot am I touching?
Inside.
Move up to your upper extremities. I'm feeling pain.
Cheekbones. Ow. Ouch. Ow.
Check your elbows. Sure.
Ow, it hurts so bad.
So scary. Okay, can you give me your hands down? Thank you. Are her pulses equal and bilateral?
Pulses are equal and bilateral.
You go ahead and squeeze my fingers for me, ma'am. Thank you. What finger am I touching?
Middle finger.
What finger am I touching?
Thank you.
Okay, cool. Can you get ready to log on the patient?
Ouch.
Ma'am. And we're going to be obviously holding immobilization for her leg and her arm. Fire, we're going to roll her on your count.
Alright, on 3. 1, 2, 3.
Checking spine. Looking for step off, sacral edema, hip rigidity. Okay, cool. Are you ready, secondary? Okay, on heads count.
On 3. 1, 2, 3.
Damn, perfect.
She's a little. Yeah. Can you get her leg on the page for me? Alright, on heads count, we're gonna move her straight down about 3 inches.
Alright, on 3. 1, 2, 3.
Sorry, a little further down.
Alright,
On heads
on
count.
3. 1, 2, 3.
Alright. Which should be good. Okay. Then I would strap her in, start with the torso, laying down, head. I'd recheck CSM. Ma'am, can I see your hands, please? Thank you. Our pulse is equal and bilateral. Our pulse is equal and bilateral. Can you squeeze my fingers for me? What finger am I touching?
Index.
And what finger am I touching?
Thank you.
Okay, good. Check down here. Our posterior tibial pulses equal and bilateral.
Pulses are equal and bilateral.
Okay, man, can you look at your feet for me? Can you tell me what side of your foot am I touching?
Inside.
One more time.
Outside.
Okay, cool. And then we'd get her into the ambulance. Alright, I'm gonna go into my history taking, so signs and symptoms. Obviously, facing a lot of pain in her arm and her leg. Do you have any allergies?
No,
No, do you take any medications?
not right now.
Do you have any past permanent medical history I should know about? Surgeries?
No.
No, okay. What was the last thing that you ate?
I had water
You had water? Okay. And when was that?
like 2 hours ago.
Okay. And then what was happening before the incident?
I was kind of driving and I think my car like swerved because I saw an animal.
Okay. Okay. And your pain, does anything make it feel better? Does anything make it feel worse?
Everything hurts right now.
Okay. And
I don't know.
what does the pain feel like? Can you describe it to me?
It feels like shards of glass under my skin.
Okay, shards of glass. That's terrible. Is it moving anywhere, or is it kind of just staying?
It's
in
all
your-
over my body.
It's everywhere. Okay. And can you rate your pain 1 to 10 for me? Or sorry, 0 to 10. 10 being the worst pain you've ever felt.
Like a 9?
Like a 9. Jeez. And time was this was 1500. I will be reassessing vitals every 5 minutes, and we will be handing off care to the doctors in the hospital when we arrive.